So, as Susan mentioned earlier, I am a physical therapist by background. I have a little slide about me coming up. Um, I am originally from a small town outside of Pittsburgh, and I moved to Florida in June of 23. I received my Bachelor of Science in Athletic Training from the Indiana University of Pennsylvania, and I received my Doctorate of Physical Therapy from the University of Pittsburgh. And I currently work at the Encompass Health in Sarasota as a physical therapist on the weekends. And I'm also a Power certified therapist. For those of you that don't know, Power is a Parkinson's specific exercise program that to help the symptoms of Parkinson's, like stiffness, bradykinesia, all of the stuff. And I currently work as a clinical specialist for Medtronic in their deep brain stimulation division. So I'm going to be talking to you today about the benefits and importance of resistance training, stretching, and facial exercises. And if I'm talking too fast or anyone has any questions, please raise your hand. Feel free to stop me, anything. So before we begin, I just wanted to add a quick slide of what is DBS therapy to make my job make sense a little bit. DBS delivers controlled electrical stimulation to the brain to help block some of the brain signals that cause the movement symptoms of Parkinson's. DBS is an established, safe, and effective therapy. It is FDA approved and clinically proven, and DBS helps to improve tremor, bradykinesia, and rigidity. If anyone has any questions specifically about DBS, I'll be happy to answer those separately at the end. All right. So our first section we're going to start with is resistance training. I'm going to start with a question. How often do you strength train? There are no wrong answers. Feel free to just raise your hand. Never. Anyone? Well, I hope that'll change after this. Sometimes. Okay. Often. All right, we're getting better. We're getting better. All right, every day. Anyone work out every day? Okay. I like to see that. Susan's doing a great job over here. Okay. So why is it important to strength train and why should you do it? Few reasons why it's important for people with Parkinson's to strength train. Muscle strength and power are reduced in people with Parkinson's compared with age-matched healthy adults, and a decline in muscle strength and power in Parkinson's disease have been reported to be associated with reduced functional performance, walking speed, postural control, balance confidence, and an increased risk of falls. Resistance training has been shown to be beneficial in improving strength, balance, and functional capabilities. And people with Parkinson's disease have a lower bone mineral density than their healthy peers, and a lower bone mineral density may cause an increased risk for hip fracture or other fractures. Okay. Next, we're going to talk about the FIT principle, and this will be a common theme for both the resistance training and the stretching and flexibility that I'll get into later on. So the FIT principle is an acronym that represents frequency, intensity, time, and type of exercise or elements to consider when developing an exercise program. Frequency is how often you exercise, and research from the Parkinson's Foundation suggests that people with Parkinson's do at least 2.5 hours of exercise a week for a better quality of life. Intensity is how hard you exercise. The ACSM guidelines and the National Parkinson's Foundation recommend moderate to high intensity, or about 50 to 70% of a 1 rep max. So that strongest exertion that you can do to just get 1 rep. You want to be doing about 50 to 70% of that intensity. And this is going to vary by individual and should always be done safely to avoid injury or adverse events. Time, or how long each exercise session lasts. If the goal is 2.5 hours of exercise per week, then this correlates to roughly 30 minutes of exercise per day, which is about the time of an average TV episode. So while you're watching some Netflix at the end of the night and you're winding down, we can pull out those programs that I passed out and do a couple reps there. Make sure we get it in every day. And then type is what type of exercise you do. So the ACSM and CDC recommendations state that every adult should perform activities that maintain or increase muscular strength and endurance for a minimum of 2 days per week. So the next slide shows a table which outlines the FIT principle for different types of physical activity specifically for people with Parkinson's. So this is the handout that you will see in front of you. Like I said, it outlines some different types of activity, the aerobic, strength training, some balance and agility, and flexibility as well. This would be a really good resource and reference for you all to take home. If you're ever curious about how many days a week or for how long should I do specific type of activity, always super helpful to refer back to this as well. Any questions so far about the table or anything I've covered? We feeling good? Okay. So what does the research say? I'm a big fan of backing up what I say. So I found this awesome research article. It was a 2-year randomized controlled trial of progressive resistance exercise for Parkinson's. The key word to note here is progressive. So we always want to make sure that we're doing more than we could before. In this study by Korkos et al., the authors aim to determine whether progressive resistance training, or PRE, is more effective than a non-progressive stretching, balance, and strengthening program for individuals with moderately severe Parkinson's disease. The objective, the study sought to compare the outcomes at 6, 12, 18, and 24 months for Parkinson's patients undergoing either progressive resistance exercise or a modified fitness count program, which includes stretching, balance, and strengthening exercises. They found that the progressive resistance exercise led to both statistically and clinically significant reductions in UPDRS3 motor scores. So when you go to,
Just gone. 4 months later, a couple kids found her body in a dump.
Hi to our Zoom listeners. If anybody is on unmute, could you please mute yourself?
They plastered Milana's foot on the walls of headquarters and all this.
Excuse me. Over to the side.
Hey guys,
Hi.
Guys, hey. We can't hear her because of y'all. Y'all find another room, please.
Thank you. Okay. Thank you, everyone. Okay, I will just hop back super quick. So talking about the importance of why progressive resistance exercise and why we need to keep ourselves getting stronger. So the results they found in this study was that progressive exercise training led to both statistically and clinically significant reductions in UPDRS3 motor scores. So that's the testing when you go to your neurologist and they have you do all the motor tests where you have to tap your foot and, do all these. And then when you walk up and down. So that improves significantly. And then, so that just supports its use as an effective adjunct therapy for improving motor symptoms in Parkinson's. Yes.
What's the progressive part of progressive resistance exercise?
Yeah, great question. So for example, say you were doing a couple reps with a 2-pound weight, like a couple leg exercises with 2 pounds, and then you find yourself as you continue to do it, oh, this is a little easy and I can do 10 reps now. Maybe I should increase the weight so that it's harder for me to complete 5 reps. Yep, so you want to increase the resistance and always make it a challenge for yourself to get those last few reps. And that's how we build muscle and build strength. Okay. So while both the progressive resistance exercise and the other group showed similar improvements at 6 months, the PRE group experienced greater gains at 12, 18, and 24 months, highlighting the importance of consistent resistance training. So this suggests that PRE should be incorporated throughout all stages of Parkinson's disease to slow progression and enhance overall quality of life. As a physical therapist, I enjoy challenging my patients, and PRE is an excellent tool to achieve this. Many participants in the study found the program both rewarding and motivating, underscoring its effectiveness in promoting long-term engagement. Think of it as kind of like you're playing a game with yourself. Like, oh, last week I was able to do 2 pounds. I'm going to try 3 pounds next week. You know, always trying to outdo yourself and keeps it motivating. Okay. So the home exercise program. We're going to walk through a sample home exercise program together. I've made copies of this as well if anyone is interested. These exercises are pretty basic, but can be progressed or regressed to meet your needs. For example, you could add cuff weights to the ankles for increased resistance or perform the exercises in standing. I thought it would be fun to walk through a couple of them. Maybe we can all do them together. They are all in sitting, so we should all be good there. Oops. Take a copy and follow along as well. All right, so we are going to start with seated ankle pumps, and we're just going to do 10 reps of each exercise so we don't take up too much time. But if everyone can kind of sit up nice and straight in your chair, get those feet kind of nice and spread apart, shoulder width. All right. So we're going to start by bringing the toes up and then pointing the toes down. Yep, and we're going to go up and down for 10 reps. Up, good. 3, up. 4, good. 5, 6. Nice. And a lot of these, I didn't add any resistance or weight to any of these exercises, so you can do them anywhere, any time of the day. Super simple. Good. 2 more, up and down. Awesome. Okay. Next one is called a seated long arc quad, but it's just essentially kicking that leg straight out, feeling a squeeze on the thigh. So we're going to do a total of 20 so that we get 10 on each side. So I'm going to kick all the way out, squeeze at the top, and control the movement on the way down. Good. So this is going to strengthen your quadricep muscles, which is very important for getting up out of a chair, for walking, for balance. Big time muscle in the legs.
And the other one, the first one?
The first one, the ankle pumps, strengthening those feet muscles. Also important for walking and a lot of other standing activities. Great questions, guys, keeping me on my toes. Good. All right, let's do 2 more. Ready, all the way up. Has anyone been keeping count? You'd think as a PT I'd be better at counting, but alas, not my strong suit. Yes.
So with increasing resistance, would more repetitions do the same thing as adding more weight? Like when you do this, would you eventually do it with like a weight on your ankle?
Yeah, you can absolutely add more reps. That's also going to make it a little bit harder, just in a different way, because then you're going to be working on endurance of the muscle rather than strength. But both are different ways to challenge the muscle and beneficial. Great question.
So these are daily that we should do this?
I did put 2 times a day, or at least daily, and then they are 2 sets of 10, I believe, 2 to 3 sets of 10. If you can do them daily, that's awesome. I believe we said frequency was 2.5 hours of exercise per week, so about 30 minutes a day. So if you want to do a couple of these exercises quick and then go for a walk, anything to get that 30 minutes in. All right. Are we all ready for the next one? Question?
We've got another class to go to,
Okay.
and so we're going to take the lead off of it, but it all looks good so far.
Awesome.
We've got a commitment.
That's totally fine. Yep, please take as many as you need. Is everyone on Zoom doing okay? Can I get a thumbs up? All right. Perfect. Okay. the next one is a seated march. So we're just thinking about bringing the knee up to the ceiling. This one is a little harder. So if you eventually don't ever get to add weight, that's okay. We're gonna work our hip flexors here. Good. 5, 6. I'm gonna get better at counting. 7, 8. Good. 9, 10, 11.
A breakout on.
Good. 13,
What's the breakout?
14. We're gonna do 20, 16, 17.
Oh, really?
I know we're almost there. 18.
That's not a good thing on this
19.
record.
20. Awesome. All right. Yeah, that one is a little harder. We don't normally focus on our hip flexors as much. All right.
Mute yourself.
The next
Okay.
one's called a heel slide. Also a hamstring curl, either or. Basically just keeping that foot on the ground and sliding it all the way back under the chair. And then we're going to do that 10 times on the right, and then we'll do 10 times on the left. So this exercise is going to work our hamstrings, which again is important for getting up out of a chair, walking, a lot of functional activities. It's the big muscle in the back of the thigh. Good. I think that was 5, right? We on 5? 6? Okay. 7. Good. Yes, go ahead.
Earlier, you said that bone density loss can happen to people with Parkinson's,
Mm-hmm.
but I've never heard of being asked for them to have a bone density test, which I know women get a lot.
Mm-hmm.
Is that something that you can recommend or is done for people with Parkinson's?
So that was just part of the study. That was something I found in the research. I didn't specifically look into the bone density for Parkinson's, but I wouldn't say it's one of the more common things I've heard about, but I would be happy to dive a little bit more into the research and then get back to you on that question. Or also a good question for your neurologist or your PCP. Oh. So I'm just going to rephrase your answer on Zoom. Tell me if I'm hearing this right. Basically, as we age, naturally our bone density is going to decrease, especially if you are less active with time in older age. Okay. Awesome. Great answer. Thank you. Yes.
I
Yeah.
do a lot of exercises too.
That's a great answer, and that's a huge proponent of it for sure. I think it depends on the person's goal as well. If their goal is they want to specifically build strength, they might like these exercises more. These might fit better with their lifestyle. But if you're the type of person that you just love to exercise and be active and be out in the community with other people, I think that's just as equally important. The most important thing is that we're staying active and doing something that you will stay consistent with. Yeah, and that's like definitely another reason why I made them pretty basic. You can kind of do them anywhere for reasons just like that. If you find yourself, have 30 minutes, you're watching a Netflix show at night, maybe pull them out, do a couple sets. The more exercise and the more activity you do, the more it's going to benefit you in the long run. Awesome. Any other questions? Feeling good? You guys are awesome today. Love it. Very interactive crowd. Does anybody on Zoom have questions? Able to unmute? You doing okay? Great. Okay, last 2 exercises, and then we're going to get into flexibility and stretching. Okay, so this is called a seated hip abduction. So this is just kind of keep the feet close together, sitting up nice and straight, working on the outside of our hips. You want to spread the knees and then bring them back in. Spread the knees out, bring them back in. If you wanted to challenge yourself a little bit more, you could add a band around the knees and the thighs, and that would give you a little bit more resistance to work against. Good. Couple more of these. Awesome. I would try to keep them as flat as you can, and you don't, yeah, it doesn't matter so much about going out as far. You just want to, like, you can even feel kind of your hips working. Yep. It doesn't have to be perfect.
You're sitting right now.
All right. Yep.
Oh, no.
Awesome. Okay, and then last exercise is called hip adduction. So it's just the opposite of what we did. So now we're focusing on bringing the knees together. You can use a ball or a pillow or something in between your thighs if you have it handy, just something to push against a little bit. Good, and these are going to strengthen our adductors, which are on the insides of our thighs. Good. A few more here, and then we'll get on to stretching. The purpose of the hip exercises to build strong hips, very important for going up and down stairs, or specifically standing on one foot for any period of time, stepping over objects, things like that. Different functional tasks. All right. We feel good about the exercises? You guys did great. If you wanted to pick a good one just for a whole body, I really like sit to stands. It's a very functional movement. It's compound movement. It's going to have all of the joints and the lower extremity muscles. So, yep. You can even do it at the edge of your bed, in front of your walker, from a different chair, or just up and back. And then if you need to push, totally okay, up and back. This is a really good one for the quads as well. Very functional too. Stretching. Okay. Yep, now we're going to get into stretching, why it's important, the benefits of stretching, some general guidelines, and more. So why is stretching and flexibility important? Does anybody want to answer? Pretend you can't see the slide. I gave it away. Does anybody stretch now? Do they like to stretch? How does it make you feel? Good? Okay. So I've outlined a few reasons why stretching and flexibility is particularly important in Parkinson's. It improves overall flexibility and mobility to combat the symptoms of rigidity and stiffness. So regular stretching helps to reduce muscle tightness and increase joint flexibility, allowing for improved mobility and easier movement. It improves posture. So Parkinson's can lead to a stooped or a hunched posture due to the imbalance in muscle activity. So stretching exercises targeting the back, the chest, and shoulders can help to correct those postural imbalances. Sitting up nice and straight, getting a good stretch. Balance and coordination. So targeting the hip flexors, the hamstrings, and the calves, a lot of those exercises that we just went through together, can help improve lower body range of motion, leading to an improved gait or walking pattern, base of support, and lowering the risk of falls. Improves blood circulation. So stretching helps to improve blood circulation to muscles and joints, promoting better oxygen and nutrient delivery, which is crucial for muscle function and recovery. And it also helps to prevent cramps. Nobody likes cramps. Reduces pain and discomfort. So many people with Parkinson's experience muscle aches and pains due to rigidity and muscle contractions, and stretching can help to alleviate this discomfort by reducing the muscle tension and preventing the muscles from becoming too stiff or overworked. And this is especially important in the later stages of Parkinson's, where the risk of developing muscle contractions is higher due to decreased mobility. Promotes relaxation and stress relief. So stretching promotes relaxation by calming the nervous system and reducing the tension in the body. Supporting physical therapy goals. Stretching complements other forms of exercise like strength training and aerobic activity. So make your physical therapist happy. Supporting mental well-being. Exercise, including stretching, has been shown to release endorphins, which is the body's natural feel-good chemical, Regular exercise helps to boost mood and reduce feelings of depression. Does anybody not feel better after they exercise? We all feel really good after we exercise. Feeling a little pain and soreness? Yeah.
Except for skin,
Oh,
but otherwise, yeah.
otherwise, yes. Good. That was the answer I was hoping for. Short-term pain for long-term gain. Awesome. Okay, so just some little guidelines here, talking about key muscle groups, frequency, and time specifically for stretching. So the Parkinson's Foundation printout that I passed out earlier for resistance training guidelines also includes stretching guidelines that fit principle, frequency, intensity, time, and type. So overall, you want to target key muscle groups such as the shoulders, neck, chest, trunk, hips, hamstring, and calves. The muscles in front are typically going to be a little tighter due to the stooped posture. Again, this will vary person to person, but it's important to know your body and the areas that you feel you need to stretch or that may be tight for you. The Parkinson's Foundation recommends stretching at least 2 to 3 times a week, but daily is going to be most effective. You want to hold each stretch for about 15 to 60 seconds when you're static stretching and repeat that 2 to 4 times per muscle group. And this should be in the handout if I'm talking a little fast or I didn't have it on the slide. And it's important to note that you want to stop when you feel a good stretch, but you do not feel pain. Stretching should never be painful, and you'll find with time you may be able to go further as your flexibility increases. So just kind of keep this in the back of your mind when you're doing these exercises. Different types of stretching. So static stretching that we just talked about is that held sustained stretch for about 15 to 60 seconds for 2 to 4 repetitions of each. And dynamic stretching is about 8 to 10 movements in each direction. So static stretching is typically performed after physical activity, and dynamic stretching should be performed prior to physical activity as part of a warm-up. So I'll just do a quick example of a dynamic stretch. If we were going to do something like a toe touch, even if you don't touch your toes all the way, just kind of that repeated movement to warm the muscles up a little bit, get the blood flowing, something like that. Make sense? Perfect. Okay. And then I also made a sample home exercise program for stretching, which is the second printout that you all have. We're not going to actually do these stretches now. Some of them are a little bit more involved, and I don't know that we have the space. But I'll just walk through very briefly and kind of talk about the benefit and what they improve. So the modified Thomas stretch is focusing on the hip flexors. Hip flexors are in the front of the body, which are typically tight on a lot of people. The second one is the half kneeling hip flexor stretch. So just a different variation of stretching the same muscle, doing it in a half kneeling position. And you can look through these, kind of see which ones intrigue you, which you feel like would be safe. For example, the half kneeling stretch, you could hold onto a chair, something nearby, if you felt like balance would be an issue. The standing hip flexor stretch, again, you could do this against a wall, focusing really on those hip flexors. The supine lower trunk rotation. So when you're lying on the ground, lying in bed, bringing the knees together to one side, and then the other, kind of getting that axial and that trunk rotation, which will feel really good, especially if you have stiffness or rigidity, if that's one of your main symptoms.
Once you get there, it feels good.
It's hard to get there initially. Yeah. Right. And that's a great point. Like I said earlier, some of these stretches may not be great for everyone. You just kind of have to feel it out and make sure that you're not doing anything too dangerous or going too far or feeling pain. Those are the things you should never feel with stretching. You should feel like, oh, that's a good stretch, but that's it. No pain. Okay, the side lying thoracic rotation with an open book. I love this. This is going to get that upper back stretch. You're laying on your side, bringing your arm way over and across, really opening up that chest and that back. Standing hamstring stretch. So again, you could do this holding onto a chair, against a step, anything like that to give you a little bit of balance, hinging at the hips there for that one. Seated hamstring stretch if standing is a little too difficult. Again, thinking about hinging at the hips, getting that good stretch in the back of the thigh. Next is a long sitting calf stretch with a strap. If you have a strap, that's great. You can also use a towel or a belt. I've used those with patients before. Stretching out those calf muscles, the back of the calf. Another variation of a calf stretch is just in standing. You want to make sure that the back of the heel stays on the ground. You're kind of leaning away from it. I think we have one or two more. So alternating side stretch, really good one to kind of get the side. Want to reach over your head and really bend away from that side so you feel a good stretch. Do those on each side. Yep, kind of feel it out. Good. Is that a question or are you practicing? Okay. Love it. Oh, two more. I lied. Oh, awesome. So these ones looks like you do them in a chair. The seated upper thoracic stretch, again, opening up that chest, opening up that T-spine, getting that trunk really, really flexible. And then the mid-back stretch, a little bit of the opposite, opening up in the other direction. Perfect. Any questions so far about the stretching, the exercises? They all look pretty good? Awesome. And again, these are just examples. It's not something very strict to follow. If you're seeing a physical therapist, I always recommend asking them for exercises. They've been working with you. They kind of know your skills, where you're at, what you need. Never hurts to have extra information or exercises. Okay. So we are going to switch gears and talk about facial exercises.
Do we have something on this?
I do not have a printout for facial exercises, but I would be happy to make one up and send it to Susan. And she can use it as a reference. Yeah, awesome. You're welcome. Okay, so why are facial exercises important? One of the main symptoms of Parkinson's is diminished facial expressivity, or the masked face, like the Parkinson's mask that you may have heard of. Facial expression is a key part of nonverbal communication, and facial masking can make it difficult for people with Parkinson's to effectively communicate with others. Some benefits of exercises include increasing the tone in the muscles around the mouth can help with managing some saliva, helps with speech clarity, helps release stiffness and tension in the face and improve blood circulation. And toning of the muscles of the face may also have the added benefit of looking younger. Little facelift. Okay. And then the SLOP strategy, or SLOP. The SLOP strategy is commonly used by speech language pathologists to help with dysarthria. The dysarthria is a speech disorder that makes it difficult to speak due to weak, slow, or imprecise muscles used for speech. And we can utilize the SLOP strategy so our speech doesn't sound sloppy. So the S is slow down. You want to speak more slowly. L is for loud. You want to speak louder, especially if you have reduced respiratory capacity. O is over articulate. So exaggerate the movements of your lips and tongue. And pause, P is pause. So take longer pauses, regular pauses, especially at the end of a sentence. Has anyone heard of this before that has worked with a speech language pathologist?
We've heard of the loud and the pause, but not the other.
Not the actual slop. Okay. Yeah, I know there's the LSVT Loud is a great program too. One of my friends who's a speech therapist told me about this, and I said I have to include that. So, okay. Next, I have a video. While I was researching, I found an excellent video on YouTube from a speech language pathologist where she outlines how incorporating facial exercises can help with expression and a tutorial on how to complete a few of them. I thought the video would be easier to follow along with and easier to see, especially for those of you who are joining us virtually.
Hello, I am Cecilia Pisano. I am a speech language pathologist and owner of Amplify Speech Therapy. Today, I'd like to share some exercises with you that are really important for people with Parkinson's disease.
Turn this up a little bit.
Facial expressions are complex signals that communicate emotions. But with Parkinson's, we know that a common symptom is the decreased expression and what we call a mask-like facial appearance. One study completed in 2022 found that people with Parkinson's demonstrate less expression of happiness, surprise, or even neutral emotions. Because there's less blinking with Parkinson's, a lot of times people perceived as staring or having more negative emotions such as hostility or anger. As you can imagine, this can lead to misunderstandings in conversations. It can also impair relationships. And so it's important to convey our communication in a way that is in line with how we're actually feeling. That's the goal of these exercises today. But if you want to learn more about facial expressions and how that is impacted by Parkinson's disease, I would recommend my blog on this. I have a whole blog devoted to this on amplifyspeechtherapy.com. So let's get to the good stuff. I'm going to show you some facial expressions to help combat this mask-like facial appearance. The goal is not with these exercises so much to build muscle, but to bring awareness, to improve blood circulation, to decrease stiffness, become more aware of what it is our face is doing when we're having a conversation. Feel free to return to this video at any time. It's a resource to you. It's difficult enough to make these expressions in front of a mirror by ourselves, so that's the other benefit is you have somebody who's willing to make those silly faces with you. I would recommend completing these exercises daily when you start, and then as you start to get better at them, continuing a few times a week would be good, and then once a week if you feel like you really mastered the impact that you want to have with facial expressions in your conversations in everyday life. One other important note I want to make when you do these exercises is to exaggerate. These exercises are meant to be used in their fullest expression. So if you can exaggerate these movements, knowing that this is not really how you're going to convey a look of surprise or a smile, it's really just to get comfortable with what your maximum range of motion is when you do smile. From that, you can decide what feels like a more appropriate smile, what feels comfortable and right for you for the moment. I'll lead you through them and encourage you to do them with me. And we'll do 5 repetitions of each exercise and hold each one for 5 seconds. So we're going to start with the brows, and we're going to do a raised eyebrow, and this is meant to convey emotions such as surprise, questioning, curiosity, maybe even mild disapproval. But we'll use the eyebrows for a lift, hold it for 5 seconds, rest, and then do 5 of those. So to start, let's get going. We're going to raise the eyebrows and relax, and do that again. relax. Again, remember we're going for the fullest expression. So it might seem exaggerated, and it is. Again, lift, lift, lift as much as you can. You want to wake up those muscles. Let's do one more. Great job. Okay, so now we're going to go to a knit brow or a furrowed brow. This can communicate thinking, worry, anger, confusion. I find this one the hardest to do. I don't know why, but we're just going to kind of bring the brow together, hold for 5 seconds, and relax. And do that again. Think about exaggeration. I mentioned this was hard for me. We're going to go 3 more. Knit, 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 knit. I'm saying that for myself.
Everyone scowls.
And relax. 2 more. Furrow that brow.
Knitting the brows.
Good. 1 more.
Scowl.
Great. Relax. Okay. We're going to move to the eyes. And for the first one, we're going to open the eyes as wide as we can and hold it for 5 seconds. So let's start. You might do, okay, let's go again. You might get a little bit of brow involvement. That is completely okay. Many of these facial expressions really don't happen in isolation. So that is completely normal. So let's do another eyes wide open, as wide as you can go. This is 3. And rest. We've got 2 more of these. And rest. 1 more.
I think she mentioned you could use looking in a mirror, looking at a partner.
Okay, so the wide eyes obviously convey surprise, could be sarcasm, could be fear. Let's go to closing the eyes tightly. This closing the eyes is using this exercise in exaggeration, right? But we do crinkle our eyes when we smile. So we're trying to exaggerate, but use that muscle, those muscles that help with the closing of the eyes to correlate with smiling with our eyes, and disagreement or confusion are other ways that we sort of create a squinting. But because we're going for the full expression, we're going to close the eyes tightly. So I'll count for us. Let's close together. 1, 2, 3, 4, 5, and rest. And again, close, 4, 5, and rest. You can open. And now let's do another closure. 4, 5, and rest. 2 more. Close.
Keep those eyes closed though.
And open. 1 more. Close tightly and rest. You can open. Okay, so we're moving to the mouth. We're going to start with a broad smile. So again, exaggerate. This may not be your everyday smile, but we just want to exaggerate, wake up, and just experiment with what is full range of motion. So give me your biggest smile and hold it for 5 seconds.
I have to see those pearly whites.
Great. Again. Relax. Again. Okay, again. Relax, we've got 1 more. Let's go. Great. Okay, so our smile, obviously, happiness, joy, delight, amusement. We're going to do the opposite of the broad smile with a lip pucker. Okay, so the pucker is bringing the lips together, also pursed lips. Really important for conveying tension, frustration, disapproval, anger. But I will say the other important thing about lip closure is if anyone's having any difficulty with loss of saliva, it might be because with lax jaw and lips, you're finding that your mouth is slightly open throughout the day without much awareness. So we want to bring some awareness of these muscles, improve their strength, and maybe even decrease on leakage if we've got good awareness of how to create a closed lip posture. So we're going to pucker the lips, close them tightly, hold it for 5 seconds. Relax. And do that again. Great. So let's do another pucker.
Great. Pucker the lips.
Good. 2 more to go.
Sour.
Pucker.
The blackmail a lot of times. I would never.
Okay,
This is being
one.
recorded, but not you guys.
Great. Okay. So I've got just one more for you. It is a jaw exercise. It is not really a facial expression exercise, but I am including it because I think it's really important for lots of things. 2 main ones, speech and chewing. If anyone's done any voice therapy, you might remember that they often teach you to do a vocalization ah. You might have gotten some feedback about opening the jaw a little bit more. So normally when you do that exercise, you want a nice relaxed opening, but we're going to take this a step further and go for the maximum opening. This is helpful in the sense that, again, if we want to just waken those muscles and increase our awareness of what our jaw is doing. If you find yourself sort of talking with decreased mouth opening, it starts to sound muffled. So we want to get more comfortable with opening more so that the sounds come out. The voice is more resonant. The other benefit is with chewing. If you're having any difficulty with chewing solids, you know that the first step to swallowing is chewing thoroughly. So if you're not comfortable with, or you're not getting full opening of your jaw when you're chewing, then you're going to have minimized chewing efficiency. We're going to open the jaw, hold it for 5 seconds. I've got another note. If you have any TMJ, I'd like you just to back off and do what feels comfortable. You may not get that full opening. Just go to what feels comfortable with you. If you have any clicking that persists, then you might also want to talk to a specialist about the TMJ. So we're going to open for 5 seconds and hold it for 5 seconds. You're ready. Let's go. And relax and open. Relax. Open. Open again. Great. Last one. All right, we've done it. We've done 7 exercises that will help with facial expression. Now, I would recommend, as I mentioned, you want to practice these exercises in isolation, but then also put them all together. When you use the mirror, sit down and think about, well, what is my ideal smile? Not your full expression, exaggerated smile. Incorporate your eyes in your smile, right? So put all these isolated exercises together to find the right expression for you. You can practice surprise. You can practice disbelief. You can practice joy, enthusiasm. So there's no limit on where you can take these, and they need to be personalized to you. So spend some time in the mirror and figuring out what that is. But to get there, you really want to find what your maximum range of motion is and get that feedback for how you're being perceived. And that way your expression will be in line with how you're actually feeling. I want to thank you for joining me in these facial exercises.
Yeah, I like that video a lot. facial expressions and speech and swallowing is not my strong suit as a physical therapist. So I definitely wanted to pull some resources from some speech therapists and ones that do it on a more regular basis for sure. Awesome. Does anybody have any questions for me for the group discussion? I know we talked a lot about throughout the presentation. Awesome. Okay. Thank you all for letting me come and talk to you today. Hopefully I was able to share some good knowledge and you absorbed a little bit of it. My contact information is here. I also have cards and I'm local to Sarasota. I'm popping in and out of here quite a bit, like Susan mentioned earlier. So I'm looking forward to seeing you all again soon.